The hopes that you bring, the dreams that you share, the pleasure you get when you know that we care. The faith that you place, the trust that we share, the joy in your heart when you know that we care. You before we, as you USV. You before we, as USV.
USV, your reliable healthcare partner.
Hello viewers. Heart attack, and in many common languages it's called Dil Ka Daura, is a very distressing, disabling and a life-threatening condition. Now India has become a capital of heart attack in the world. Nearly 30% of deaths from heart attacks across the world happen in this country. Practically over the last 40 years, deaths from heart disease have decreased in the West by 50%, and yet in India it continues to rise. 400% over the last 40 years, 50% even over the last 10 years. These are amazing, astounding and distressing figures. Nearly 1 in 4 individuals in this country dies from heart attack or heart attack related deaths. It's occurring even at a younger age group. 25% of the heart attacks happen in people who are less than 40 years. 50% of the heart attacks are in people who are less than 60 years. What does that mean? It means that in the prime of life, one is affected by this disease process, which can be disabling, which can take you off work, and occasionally life goes away with a heart attack. And yet, it's important to understand that many of the preventive aspects or treatment aspects of heart attacks should be known, because we can actually work towards preventing and getting disabled by it. If we look around ourselves, either us or one of our close friends or relatives have already had a heart attack. So under this initiative of Halt's heart attack, it becomes important for us to actually convey the knowledge of heart attacks to you all, to discuss about heart attacks, its treatment and its prevention. And for this, we have an expert panel from all across India. I'm Dr. Ashok Seth, the chairman of Fortis Escorts Heart Institute in New Delhi. And with me are some of the most experienced and able cardiologists from around the country. With me here is Dr. Sudhir Saxena, Director and Head of the Department of Cardiology at the Max Super Specialty Hospital in Mohali, Chandigarh. We have Dr. Rishi Gupta with us, Director and Head of Cardiology at the Asian Institute of Medical Sciences in Faridabad. Professor Tom Devasia, who is Professor of Cardiology and Head at the Kasturba Hospital and Medical College in Manipal. And then we have Dr. Anurag Malhotra, who is the Chairman and the Chief of Cardiology at the Sidh Hospital in Moradabad. This experienced panel is going to discuss about heart attack and its management. My first question is to Dr. Sudhir Saxena. What is a heart attack? I mean, people do get confused about chest pain and heart attack. So what is this term heart attack and what does it mean to an individual?
Heart attack is a catastrophic condition. It comes as a bolt from the blue. It's a rude shock to the patient. It happens when the blood supply to the heart is suddenly cut off. If we go into the anatomy of the heart is a muscle. It's a muscle pump which requires energy and nutrition to keep pumping blood into the body. It is supplied by 3 arteries which are called the coronary arteries. Whenever one of the coronary artery gets blocked totally, suddenly, then it leads to a heart attack. Let us not distinguish it from a condition called a stable condition where you have got a partial block in the coronary artery. And these partial blockages can cause attacks of angina or chest pain when a person exercises or walks. Heart attack is an emergency. Heart attacks do not happen overnight. They give you time basically to take treatment, to seek treatment, but unfortunately most people do not do that in time. And when it strikes, unfortunately 40% people still do not reach the hospitals in time and they die. That is why it is such an important condition, and that is why it needs to be corrected immediately.
So what you're saying is heart attack is a sudden killer. It can come on unexpectedly. Many of the instances where we hear that kal to wo theek tha, aaj wo suddenly collapse hoke death ho gayi, is happening due to a heart attack.
Absolutely right, and it is happening more and more in the younger individuals of our country these days.
That is very worrying. So Dr. Rishi, what are the symptoms of a heart attack? What should we watch out for? How do we know we're getting a heart attack?
Yeah, actually 80% of time you have central chest pain, retrosternal chest pain, and this chest pain most of the time may go either to the left or the right arm. It may go to the back, to the throat, and many times it is associated with the sweating and vomitings, which may happen in about 80% of the time. And the pain which happens is normally 2-3 types. Either you can have a serious constriction type of feeling, serious pressure type of feeling, and many times the patient can have a retrosternal burning, and many times the patient is confused that it is an acidity, because many times it is associated with vomitings as well. So this is the classical symptoms of chest pain, and normally if these symptoms persist more than half an hour, then this is a sign that possibly the patient is developing a heart attack. And in those cases, if you have these type of symptoms, one should always consult a nearby cardiologist to confirm whether this is a heart attack or not. In 5 or 10% of cases, you can have an atypical type of chest pain. Atypical type of chest pain, patient may not have central chest pain. Patient may have chest pain on the left side, may have chest pain on the right side, may have pain in the jaw or in the neck.
Right.
Sometimes in the back
Sure.
or in the epigastrium.
Sure.
And in some cases, in less than 5%, you can have a silent heart attack.
Okay. So in a sense, not to worry the viewers, but what you're saying is that even indigestion can actually be a symptom of a heart attack, and if the indigestion does not go away or is unusual or not going away with antacids, at least an ECG should be done and immediately a help should be sought. I think it's a very important message, and occasionally in diabetics, just sweating may occur. So all these need to be investigated. I think that's important. Now, Dr. Tom Devasier, heart attacks usually happen in the family. What worries us is that nearly 10% of individuals die at the time of presentation of the heart attack. They can just collapse in the first hour itself and die. So what is it that the relative or the patient can do? Let's talk about the relative. Suddenly, there's a heart attack which occurs, the patient is at home and the relative is around, but the patient collapses. The person collapses. What can a relative do? What can a bystander do?
This is a very important question, because when a patient collapses during a heart attack at home or in a public place, wherever it is, then very often there is no doctor available close to him. So it's important that the person standing next to him knows how to do the cardiopulmonary resuscitation. Maybe as a commoner, it is not easy to resuscitate both the cardiac and the pulmonary part. So it should be emphasized that every single citizen of our country should know how to give cardiac massage. So the lower end of the sternum, the person who is next to the collapsed individual should make himself comfortable, keep the chest open and start compressing. Maybe for practicality's sake, they can think that you need at least 2 compressions in 1 second, so that it may not happen that much for a beginner, but still it is better that he keeps compressing the chest and keeps the circulation going, so that the brain is not damaged significantly and the individual has a chance to survive.
Till help comes.
Yes.
And a sudden thump on the chest
Yes.
can also revert the rhythm back and bring a patient back alive. So the
Yes.
first thing is a
That should be
thump
the
on
first-
the center of the chest.
Yes.
I think that's important. Dear viewers, don't go anywhere. We'll be back after a short break.
The homes that you bring, the dreams that you share, the pleasure you get when you know that we care. The faith that you place, the trust that we share, the joy in your heart when you know that we care. You before we, at USP. You before we, at
USV, your reliable healthcare partner.
Welcome back to the show. Dr. Anurag, it's often asked to me certainly, and a lot of you all, when a patient asks us, what if I'm having a heart attack? What should I actually do? What is the first aid that I can have before I get to the hospital? What can I do? So what is your recommendation when a person believes that he's actually getting a heart attack?
It is a very important question because there are large number of heart attack cases which are occurring in our country. One should be aware what should we do when we think we are going to have heart attack. Simple thing is we can take a tablet of aspirin which is known to decrease the mortality by 11%. That is a very simple medicine. It is usually kept in home and you are required to chew it only. Don't go for water. Other thing which is important is you should not lose your cool. You should inform your relative or your friend you feel comfortable with and rush to a center which is equipped to deal with the cardiac emergencies. That is very important. And you must be aware of the centers which is nearby you, which is equipped to deal with emergencies, so you don't waste time in deciding where to go.
So I think what you're saying is time is muscle.
Right.
The fastest you get to the hospital, the better is your outcome, the faster the treatment will be. And in that 1 hour, 10% people die. So it's so important to get to the nearby hospital and keep the nearby big hospital, which has all the specialists in your mind. I think that brings to the point that when you get to the hospital, Dr. Sudhir, what should a patient expect? What sort of treatment should patient expect? He'll have an ECG, obviously.
Yes.
He will be going to the emergency. But what are the possibilities of his treatment?
So, when a patient of heart attack reaches the hospital, first of all, the diagnosis is confirmed with an ECG. Then following that, if the patient's vitals are not proper, then probably the emergency staff is going to give him some kind of a resuscitation or some kind of fluids and all. But most importantly, I think in today's world, what is more important is to recognize that heart attack kills by the minute. So if the hospital where you have landed into carries an angioplasty program, that is a primary angioplasty program, which is 24/7, then you have to accept that program immediately. You have to accept that the patient will undergo a primary angioplasty immediately to save his life. Do not waste time talking to people or thinking about it whether the procedure is ethical or not ethical, because this is the standard of the care today. If unfortunately you land up in a hospital where primary angioplasty facilities are not available, then the next best option is a blood clot dissolving medication, which is called thrombolysis or fibrinolysis, and that also has to be given as fast as possible.
The patient does recover from whatever treatment that we've given, usually an angiography, angioplasty, stent implantation, and is ready to go home. Is he going to rest at home, Dr. Rishi? So what is your recommendation when you discharge a patient after a heart attack?
Normally, when a patient is discharged after a heart attack, the activities what we recommend is based on the type of heart attack you had. You can have a major heart attack where the heart muscle may become very weak, and you may have a heart attack which has caused very little muscle damage. Naturally, the patient who have a little muscle damage, then we advise them to be ambulate as fast as possible. And then actually this early ambulation starts in the hospital itself.
So you encourage them to walk?
Correct. We encourage them to walk in the hospital itself, maybe initially in initial 1 or 2 days in the room, in the room itself, and then maybe in the corridors. And at the time of discharge, we say for initial 1 week, do the activities, maybe the homebound activities, should walk 2-3 minutes at least 3-4 times in a day. And naturally, we say that the patient has to take rest, as you mentioned clearly that say heart muscle damage, and heart muscle damage recovery will take at least 4 weeks. So normally we say that the bed rest has to be taken for 4 weeks. That doesn't mean that the patient should not walk or ambulation should not be done. The ambulation should be started in the home in initial 1 week, and after 1 week, then we say that you start walking outside the home, maybe 1 kilometer in the morning, 1 kilometer in the evening, and gradually with half normal activities for next 2 weeks, in 3 weeks the person should be able to do the
So in
normal
3
activities.
weeks he's back to normal. So that brings me to the point, Dr. Devasya. Can a person, a person after a heart attack always feels that he is disabled now, that he cannot get back to full life, full activities, that he is taking precautions to the extent that he always feels a sense of doom on him. Can a person after a heart attack get back to full productive life, full active life? And so can you describe that when can he have his family life, when can he have his, can he drive, can he actually go for holidays, can he go for exercise, can he play tennis? All those are issues which are realistic. So can you just address those?
Yes, this is a very common question patients have, and they always ask at the time of discharge about all these questions. So it's very important that heart attack is not the end of life. So after discharge, your cardiologist will have an assessment of your exercise capacity and will advise a graded exercise training program which you will have to follow over the next few weeks. So the risk after the heart attack comes down over the next few weeks, and by 4 to 6 weeks the patient is well on his road to recovery, and by 3 to 6 months he is fully recovered and he is as good as before at the end of 3 to 6 months. It is just that he has to continue medicines, and so it is very important that we emphasize that it is not end of the road for him once he has had a heart attack.
That's a very important point. So a person after a heart attack may be even able to play tennis, may be able to go for trekking.
Very much.
But Dr. Anurag, so for a person to be able to get to that level of confidence that he can, do you do some form of a follow-up on him as to after a heart attack, what sort of a follow-up should a person expect if he has a heart attack? Is it just prescription of medicines and then review him after a year, or what is your practice and what do you recommend?
After the incident, initial index incident, after the discharge of index incident, we regularly follow up the patient weekly interval for at least 3 months. And during those periods of interaction, we emphasize on different aspects of life, how they can do the certain things. Their working capacity can be adjusted by doing various tests, how they are able to perform that or not. This is my firm belief. Many of the time patients don't ask certain things. Supposedly sex is still a thing which patients usually don't ask, but many of the time it becomes a problem within husband and wife. So we discuss all type of the problem which patient may face it at home. By gradual interaction with the doctors, patient usually resumes confidence and is able to take life to a next level and enjoy a fruitful life.
That's an important point you brought up, and I'll bring this to then Professor Devasya. See, he mentioned about psychological issues. One of them is erectile dysfunction, inability to perform sex after a heart attack. And those are all psychological issues. There's a depression issue. So do you find this in your practice that people do get depressed after a heart attack, continue to have symptoms? What sort of a therapy do you recommend to these patients in their lives?
It's very common that we see patients who have had heart attack. Many of them have increased anxiety levels, some of them have high incidence of depression, and they keep thinking about it and they get stressed a lot. So it's very common that we advise some short duration of antidepressants to them or anti-anxiety drugs, and very rarely there are patients who will need psychiatric counseling and help on that aspect.
But Dr. Saxena, they also continue to get chest pains. I have a lot of patients who after a heart attack keep saying that they're always having some chest pain or the other and always worried that a second heart attack would strike them. Any comments about that?
Yeah, I mean that's very, very common. Most of the patients who have had a large heart attack come back and say that they are getting funny kind of chest pains, which they are able to relate it to the index event only. But unfortunately, or I should say fortunately, most of these are non-cardiac chest pains. Some of these patients are, as you say, are depressed and they are doomed, they have a feeling of doom, so they carry on this sensation of pain. Some other patients, they have a physical reason for this. Maybe they have developed what is known as a pericarditis, which may be cause of a little pain here and there. Some of these patients may have been resuscitated at some point of time and chest compressions may have been given to them, which may be causing chest pain later on. Right. But most of these patients have to be motivated and they have to be told in no uncertain terms that these are non-cardiac pains. You don't bother about it. some people have pinpoint pains. So
Right.
pinpoint pains are never cardiac in origin.
Right,
This is to be
important
told
point.
to the patient, right? And I'm sure most of these patients will improve and they will come over this fear of chest pain. Not only the patients, the families suffer from this heart attack mania once the patient develops a heart attack. A little pain in the left arm probably, and they just keep frantically calling the hospital or the doctor that this guy is again having a chest pain.
Sure. I think what reassures them also is the fact that if you are able to do an exercise test,
That's
a
true. I
TMT,
agree with you.
or some form of a nuclear scan,
Yes.
it helps them to actually get more reassured. And that brings me to Dr. Rishi Gupta. Do our patients, some of the patients believe that they'll be on long-term medications. Others believe that it's fine, I'm going to have a medication for 3 months and then forget all that medication and continue my life as normal. So do the patients require long-term medications?
Yeah, yes, correct. I think this part is very, very important to understand that the heart attack is one event. But the most important part is it is because of the coronary artery disease that they had an heart attack. Coronary artery disease means that the development of cholesterol plaque inside the coronary arteries. And this, a person who has developed an heart attack means that he is at risk of developing heart attack again. So naturally, in those situations, we always give, there are two types of treatment we normally give. One treatment is related to the stent that we implant. We have to give blood thinning drugs so that there is no clotting inside the stent. And there are the other group of drugs which we give to reduce the chances of repeat heart attack, like the statins, that we give those statins which are very, very important, which reduces the cholesterol deposition inside the coronary artery and then make the coronary artery plaque stable so that the person doesn't develop repeat heart attack. So this is one of the very important treatment. Besides that, depending on the condition of the heart, we give certain medicines to improve the heart function, like the ACE inhibitors, beta blockers, and of course the medicine for diabetes, hypertension, and to control cholesterol. So all these medicines have to be continued, and since this disease is not the one-time treatment, it is a lifelong treatment. The person has to continue the treatment for prevention of heart attack for whole life, except that the blood thinning drugs, probably after a year or so we reduce the amount
Sure.
little bit. That is what.
So essentially, what your message is that the drugs are there, not just for treatment of the heart attack, but also preventing future blockages and more heart attacks coming for the future. And that has been well recognized that there are many drugs which help that, and therefore a person should meticulously continue on those drugs in order to stay well and stay fit and avoid further heart attacks. Which brings us to the very most important point, Professor Devasya. What are the lifestyle modifications? We all keep talking about this as being a lifestyle disorder disease, cardiovascular disease. So what is the lifestyle modifications that we're talking about, what a person needs to do?
Lifestyle modification, I always focus on 3 points. Of course, stopping smoking is very, very important, but in addition to that, diet, exercise and stress management, I feel, are very important to prevent second heart attacks. Diet has to be cardio-friendly diet nowadays. Then exercise, we all have to emphasize that at least 5 days a week people have to exercise at least 30 minutes each. And then of course stress management, which is part of everybody's life. Of course we cannot change the stress happening to us, but we can always change the way we respond to stress. That makes a big difference to how we manage stress. That will reduce the overall incidence of future heart attacks in terms of lifestyle management.
That is a wonderful message, and I hope everybody noted that message down, Professor Tom Devasya. I always say the other way around. Prevention of heart disease is in your feet. If you walk daily for 40 minutes every day for 5 times a week, then you decrease your heart attacks by 25%, you lose weight, you control your diabetes, you control hypertension, you have a psychological well-being, you're motivated, and you're ready to face the world. So I think prevention of heart disease is in our feet, and we must remember that, viewers. You've heard from our expert panelists about heart attack, its presentation, its treatment, and its prevention. It's now up to you all to put this in your daily life and prevent heart attacks yourself. Thank you very much from this Halt Heart Attack Initiative and listening to us.
The homes that you bring, the dreams that you share, the pleasure you get when you know that we care, the faith that you place, the trust that we share, the joy in your heart when you know that we care. You before we at USP, you before we at USP.
USV, your reliable healthcare partner.